The maiden edition of the Church's Community Free Health Screening brought together a team of medical professionals who offered free services, including eye examination, blood pressure checks, diabetes and malaria testing, typhoid screening, and general medical consultations to the community of Restoration Center Medina Estate. The lead pastor of King's General International Church, Pastor Eric Abraham Appiah, established that public awareness and preventive health practices are vital, not just to maintain freedom from cholera, but also to curb other preventable diseases. He further noted that many residents lack basic knowledge of their biodata and health status, which can lead to complications later in life. In line with the Church's mission to cater to the body, soul, and spirit, he stressed the importance of integrating spiritual care with physical health care, especially for people living under unhygienic conditions, battling stress, or unable to afford hospital bills. The pastor described the outreach as part of the Church's broader mission to drive holistic community transformation.
Unaware of their basic biodata, things about their pressure, their sugar level, basic things that can complicate life in the future. That I believe as a church, by the grace of God, we can help them discover so that they can be healthy. Because the church mission is to the totality of the body, spirit, soul, and body. So today, our mission is to the body and our mind. So that's why we organize it. We call on partners because of we are a church. We are not a medical profession. So we call on partners who are in the medical field. We have partners from other churches who have their medical team here. We have pharmacists, so people who are in the medical field who donated medicines and then also provided the human resource to come and help us achieve that goal. So when I look around, I can see that we have people are receiving free drugs. We are having people are checking their sugar status, sugar level. People are checking the breast to see if there's any breast cancer or something like that. We also people checking their eyes. We have a dental unit. They are checking the status of their teeth and many other things of their body, their eyes, their teeth, and to make sure that they are totally well. Many people think that the church is only focused on the spirituality, but the church is focused on the body, spirit, soul, and body. That's what the Bible says, that we should present our body, our spirit, soul, and body irreproachable to the coming of the Lord. So our focus is not only on the spirit, but also on the body. Because if your body is not well, the spirit lives in a wealthy body. So that is why, for us, it's not out of place to reach out to the community, for them to know that the church thinks about them, God thinks about them, and God wants them to be healthy, to eat well. So if as you are listening, there are some, what is going on right is education, health education. Yes, people should know things about how to keep themselves healthy in their body. What makes a great nation a healthy people? Spirit, soul, and body. So we should be careful about what we eat, what we drink, keep ourselves well, healthy, our mind renewed, less stress, so that we can live longer to serve society, our nation. So when the nation is healthy, we are all healthy and we all move forward. That's the reason why we organize this screen. One of our major things, many people know me in the area, I don't like illiteracy. So people know that if you come to this church, you have to go to school. So I make sure the people, the neighborhood, the children in the area, they go to school. That's a basic thing a human being can receive a good education. So that's one thing we have done to make sure people go to school and they not go to school, they continue education to the university. So that's a little bit of that we have done, especially education-wise. Yeah, this is a maiden edition. This is our first edition of free healthcare. Next time it will be greater and bigger. Yes, we've learned from it, and I know next time we will reach out to a wider scope of people. We've learned from it. This will tell us that people really need assistance. We don't want people to wait. Most people go to the hospital when they are not well. But this is a little bit preventive. Healthcare is not just curative, but also preventive. They are preventing, if like danger and catastrophe. So this, when people hear about free healthcare, I met a young man. He said they discovered I have high blood pressure and I've never checked it in my life. That's what he said. He said, "Wow, I never knew I had it." And I thank God for him coming. He was very, very grateful. And he doesn't go to church, so you see that the program benefited only church people, but anybody at all who walk in and have himself checked. And next time we do better.
Some beneficiaries and partners who spoke to the press expressed gratitude for the initiative and called for greater collaboration between churches, NGOs, individuals and the government to extend such healthcare interventions to vulnerable communities across Ghana.
It has been very, very helpful. I wanted to know my health status, whether I was okay, and when I checked, so far so good. I must say kudos to the organizers for a good job done, and I must also say thank you to the participants, because without them this exercise wouldn't have been fruitful. And so far so good. I must say this exercise has been a fruitful one, and we thank God for it. I would love it to be done periodically, because some of the sicknesses and illnesses will not always manifest, but in due course, when they manifest, we know that when it's detected earlier, it will help save lives and the community.
It's a hospital that is interested in personal health care and community outreach. We decided to partner with the church today as a way of also giving to the community and have this opportunity to tell people about the importance of taking care of their health, be able to have access to health care that they don't have time to come and have access to in our facility. So as the hospital's little way of giving out to the community, we decided to partner with the church to help the community and also benefit from our healthcare system. So on our stand, we are giving Hep B vaccine, hepatitis B vaccine. So we have a stand where you take the test. After taking the test and you are negative, we give you the Hep B vaccine at a discount, not at the normal price you get at the market. And also, if you have a health insurance card, we have some drugs that we'll give to you for free, based on the prescription from your consultation. So hepatitis B is a serial killer. That's something most people don't know. So as a precaution, I would advise everyone watching, listening and here today that they should take the vaccine. That is the best way to keep safe. So take the vaccine. Once you are vaccinated, you can be able to protect yourself from such a deadly disease.
My breast, they saw some rashes and they asked me to go and do some scan. I'm happy because if I didn't come, I wouldn't know this is what is happening to me. So I thank God, and God bless you all too.
So your advice to women?
I'm advising women, maybe if they are saying they are doing some tests, you have to go and check so that you see what is worrying you. That's what I say.
It's been really helpful. I've been given a free breast screening. I usually do it myself, but they've taught me other things. We've spoken about diabetes. I've gone to the lab. I've done hepatitis. I also went to the ophthalmologist, is it? Optometrist, to get my eye checked, and then I saw the doctors as well, and then I also had my BP and everything. So I've basically had everything, and it was for free. Sometimes we think because of our busy schedules we can't do this, but it is very important to take advantage of it. This is the second time I've seen this happening, and it's always by a church. This one is by the King's General Church, and I think anytime anybody hears something like this, they should take advantage of it. I also want to thank the churches for actually doing these things. You think people will not come back? A lot of people are benefiting from it, and by the time it's over, I'm sure many people would have gotten some sort of free health care and direction. And I myself, I'm grateful for the opportunity, yes.
Acha midini Aisha Muru na yetese omu ya program wele bae ya mishra omu ya me da so yi next time omu sai bi ma ya ne enkrofo nyina ya beba ya mishra ba doctors fa nyina next for omu share apo mu di e bibia omu nyina ya do omu ase ya mishra omu nyina.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.